Within recent times, there have been major changes in the way in which parents and children relate to and work with health professionals during a period of hospitalisation. It's hard to believe that just 30 to 40 years ago, parents were limited to only 1 or 2 visits a week and were actively discouraged from being involved in their child's care in hospital. This promotional film was made in the Adelaide Children's Hospital in the late 1950s. Although actors were used to portray the main characters, it clearly illustrates the relationship between the professionals, parents and child, and the respective roles they played.
On arrival at the hospital, Tommy is transferred swiftly to the admission room. All outside agencies have completed their task. Tommy's life now rests with the skilled doctors and staff at the Children's Hospital.
All right, sister, let's have a look at him.
Health professionals fulfilled the expert role. This approach comes from the paradigm of we know best. There was very little the parents or child could contribute to care.
How is he, sister? Don't worry, Mrs. Carslake. I'm sure everything will be all right.
The child was literally handed over to the hospital and minimum access allowed. On occasions, access was totally denied.
Nurse, will you commence charting the drugs administered?
Yes, sir.
So you're Tommy Carslake. Have either of you spoken to his mother yet?
No. No, sir?
Well, I think I'd better have a word with her. Sister, would you show Mrs. Carslake into the office, please?
Mrs. Carslake?
Yes?
Doctor would like to see you in his office. Would you come this way, please?
Yes, certainly.
I'm Dr. Hunt.
How's Tommy, Doctor?
Not very well, I'm afraid, Mrs. Carslake.
Doctor, is it?
Yes, Tom definitely has tetanus. Quite a severe case, I'm afraid. Now, I know it's no good my telling you not to worry, but please believe me when I tell you that we're doing all in our power to help him.
Mrs. Carslake speaking.
Dr. Bennett's here, Mrs. Carslake.
What is it, Doctor?
Good news, Mrs. Carslake. Tommy is going to be all right.
Oh, Doctor. These have been the longest 14 days in my life. When can I see Tommy?
Tomorrow afternoon at 2:30 for a few minutes. Tommy's still a very sick boy. We must give him a chance to settle down.
Yes, of course, Doctor. I don't know how I'm ever going to thank you for all you've done for Tommy.
Don't even try, Mrs. Carslake. Now, you ring your husband and tell him the good news. Yes, I'll see you tomorrow afternoon. Goodbye.
Goodbye, Doctor.
Just for a few minutes, Mrs. Carslake. Tommy's still very drowsy.
It's hard to believe that parents have had to struggle for so many years to obtain a recognised role in the care of their child in hospital.
Visiting hours are very vivid to me, even today. Parents could come in twice a week only, on Wednesdays and Sundays, for 2 hours from 2 p.m. to 4 p.m. Brothers and sisters were not allowed in. No parent was involved in care. If the child had needed any attention, we would have screened the bed and the parent waited outside while the nurse changed the child. Visitors used to wait outside the door while we groomed their children and tidied the ward, and then of course they could hear their own children crying but weren't allowed in. But it was really the early 1970s when the significant changes occurred. That's when we stopped the switchboard from putting over the paging system, that all visitors are now asked to leave. It is 7:30 p.m. But the people who had the most terrific impact was the Association for Welfare of Children in Hospital. And as an administrator, I can't emphasise enough the impact that group had on me alone. But it was a very long, hard haul. Since that time, the main issue has been learning to work with that family. And I believe we still hadn't got it right when I retired at the end of 1986.
So just how far have we got? In actual fact, hospitals have come a very long way in a relatively short period of time. There is a recognition that children have special needs, and as such, parents and other family members are now able to visit on an unrestricted basis. They can live in the ward with their child or stay in facilities nearby. More importantly, children and their families can now be actively involved in care. It is a fact today that almost all children who are hospitalised have someone from their family with them, involved in their care to various degrees. There is a need for health professionals to work very closely with parents and other family members. After all, they are the ones who have the closest relationship with the child and are the constant people in their child's life. It is important for health professionals to acknowledge the family's role in the care of the child and the child's right to be involved in their own care. If not, there is bound to be conflict and barriers to working together.
I'm Stephen.
Where do we go from here? A new paradigm is emerging, one of partnership in the care of the child. A partnership between the health professionals, the family and the child. This recognises that the child and family offer a special and unique kind of expertise to care. Health professionals offer another type of expertise, both complement each other. What role can the parent actually take on when in hospital? The role is a very individual one and one that can't be taken for granted. Parents can take on the role of worker, helper, visitor, patient, decision maker, advocate for their child. One of the most common roles for parents is that of worker, whereby parents provide emotional and physical care for their child. The physical care can range from the type of things they do at home for their child through to quite complex technical care that they have been taught to do. Helper. This is where parents, or in this case the child, can help the health professional to provide care, but they don't take the responsibility for the provision of that care. Visitor. Here the parents rely on the health professionals to provide all the care. Patient. This is where the parents are cared for and supported by the health professionals. Decision maker. The parents are responsible for their child, therefore they have the right to be involved in all decisions about the care of their child. Advocate. Because of the dependency of children on adults, parents have a major role in advocating for and maintaining their child's rights. In addition, because they are with their children most of the time, they can monitor the care provided by the health professionals. Parents are in an excellent position to help maintain the standard of care for their child. During a child's hospitalisation, parents can take on any of these roles, and various roles may coexist. For example, parents may see themselves as being actively involved in their child's care, but have the need to be treated as patients at the same time, being nurtured and supported.
I still feel I need a break every now and again, so one of the sisters or nurses are coming in when I have a shower, or I can go out and have some breakfast or even a cup of coffee. They'll come in and ask how things are going, and then they'll say, you know, they'll look after him for a little while they feel I should have a break, and even if you look tired, they come in and are very helpful.
I was frightened. I did not know what to do. I didn't know how to talk or to communicate. When the nurses asked me, when they started asking me if I would like to be involved, I said yes. I would like to be involved with everything that happens to Richard's care in the hospital.
So how do health professionals, parents and children work effectively together to ensure the best outcome for the child and family? Firstly, be aware that every parent and child is an individual, therefore their needs will be individual. The key areas that will help for a partnership to develop are: establish effective two-way communication, negotiate a clear definition of roles, provide consistency in the allocation of staff, and acknowledge that parents know their child the best and are the constant people for their child. In practice, it is important to review the partnership care arrangement, as parents and children may need or want to take on different roles at different times. This can depend on changes in the child's condition, parents' or child's confidence level, emotional status and fatigue. We have come a long way in a very short time caring for children in hospital. The partnership paradigm is emerging as a way to work together in a supportive environment to achieve the best outcomes for the child and family. The parents are the constant in the child's life. They take on the responsibility of being carers after discharge and have the ongoing responsibility for the child. In the interests of the child, it is therefore important that staff make an investment in this relationship by working together. How can you continue to improve your practice to incorporate the key elements of the partnership paradigm?